All right, so people will continue to enter the webinar. Before we get started, I just quickly wanted to make a couple of formal introductions. My name is Michael Kidd, and I'm Communications Director with the Nova Scotia Hospice Palliative Care Association. And with us today, we have Beth Lynch, who's Program Director, Project Manager of Healing Pathways Community Funding Program. And also joining us from Alberta is our Executive Director, Tim Guest. Tim, did you want to say a quick hello and make a quick introduction?
Thank you, everyone, for joining us. Sorry that I couldn't be there with you locally, but I had a family emergency, so I had to travel to the west. And so, really pleased to be here, and really pleased to see so many individuals interested in this initiative. And we're really looking forward to working with you through the process.
Thanks very much for that, Tim. Right. And Beth, do you want to make a quick introduction before we get, actually, you know what? We'll do a quick, some quick ground rules. We're looking at probably an hour. Beth's presentation could go, depending on how many questions you have, how much information she's going to be providing today. But we do encourage you to ask questions. If you don't mind holding them off to the end or putting them into the chat at least, because I will be moderating and monitoring the chat function. So we can keep the communication going. If there's a pause or whatever, I can certainly bring that question to Beth's attention. At the end, we'll do a bit more of a free-for-all. If you want to unmute your mics at the end, that would be great. And certainly feel free to ask questions. This is being recorded, and will be uploaded to our YouTube page. I'll likely be editing that tomorrow morning and have that up first thing tomorrow. So, and we'll share that out through email. I'll also be sending a quick survey out, 2 or 3 questions, just asking for your feedback on your experience here today. So without further ado, I would like to introduce Beth Lynch, our Program Director, Project Manager with NSHPCA, and also responsible for the Healing Pathways Community Funding Program. I'll turn it over to you, Beth, and have fun. Thank you.
Thanks so much, Mike. It's so nice to see everyone tonight. Thank you all for your interest in Healing Pathways Community Funding. And I'm really excited to talk more about this funding program, to go over some information about it, and hopefully answer all of your questions as you prepare your application. As Mike said, my name is Beth Lynch, and I'm the Program Director Project Manager with Nova Scotia Hospice Palliative Care. And tonight we'll be talking about our Healing Pathways Community Funding Phase 2 program. All right, so we're going to jump right into it. All right, so I just wanted to start with a land acknowledgement. So we begin this gathering by acknowledging that we are meeting on the unceded traditional territory of the Mi'kmaq people who have lived in this region for thousands of years. The Mi'kmaq people have a relationship with this land that is deeply rooted in their culture, spirituality, and history. We honor and respect the contributions, knowledge, and of the Mi'kmaq and all Indigenous, Inuit, and Métis people. As we come together tonight to discuss grief, bereavement, and emotional wellness, we recognize the profound connection between healing and land, and the importance of cultural understanding and community support in navigating loss and sorrow. May our conversations today be mindful and compassionate, and may they contribute to the broader sense of healing for all. So what is the Healing Pathways Community Fund? So just a bit of background for those that may not be aware. In January 2024, following recommendations from the Mass Casualty Commission, the Nova Scotia Hospice Palliative Care Association was chosen to collaborate with the Nova Scotia government, local communities, and the Nova Scotia Health to create and implement grief, bereavement, and emotional wellness services across the province. Backed by a 2-year funding commitment from the province of Nova Scotia and the Public Health Agency of Canada, the Nova Scotia Hospice Palliative Care Association launched the Healing Pathways Community Fund. We're tasked with distributing funds over 2 phases to support eligible groups and organizations in developing and implementing community-based initiatives that align with objectives of the Nova Scotia Community Grief Response Strategy and address local needs. In June of 2024, we launched our phase 1 of the project, supporting non-for-profit organizations in Colchester, Cumberland, and East Hants counties who are implementing grief, bereavement, and emotional wellness programs. In this phase, $300,000 was delivered to these communities. And as you're aware, in January of 2025, phase 2 has launched, making $500,000 available to eligible registered nonprofit groups and organizations throughout the province. So who can apply for funding? So to provide direct financial support to the communities in Nova Scotia impacted by April 2020 mass casualty event and other situations across the province that has caused grief, loss, and stress, and in alignment with the objectives of the Public Health Agency of Canada's funding of the response to the Mass Casualty Commission report recommendations, and to enable and encourage the development of community-level initiatives, which will provide necessary services and supports to Nova Scotians in the area of grief, loss, bereavement, and emotional well-being. And then also to support the availability of effective and long-lasting resources to strategies in communities that will enable broad public access to such services and supports. So what initiatives qualify for funding? So to be eligible for community funding, applicants must be a registered non-for-profit organization or a charity based and operating in Nova Scotia. We also welcome partnerships between nonprofit societies and charities, as well as informal groups, individuals, schools, health organizations, or workplaces. So anyone with good ideas is encouraged to partner with a non-for-profit organization or charity for the purpose of submitting a project funding request. Informal or unregistered groups may also be eligible for community funding under this grant opportunity. However, one nonprofit organization or registered charity must be the lead applicant for the purposes of this funding. The informal or unregistered group must have signed a formal partnership agreement with the lead applicant prior to applying for the funding. So it really would be a team effort, but the charity or nonprofit would be leading the along with the organization. So who can benefit from the funding? So this quote always sits with me, so I wanted to add it in here. So where there are people, there will be grief. People experience grief and loss in many ways, and not all supportive approaches will work for everyone. So applicants are encouraged to develop projects or initiatives that have a clear focus on supporting those that are experiencing grief, loss, and bereavement, and which aim to restore them or support them in their journey of emotional health and well-being. So training in support of grief and loss for community leaders and workers, maybe train the trainer approach could be an example. Community events, such as webinars, workshops, healing circles, maybe cultural ceremony activities, learning events, volunteer training, family-centered activities such as healing circles, individual and group program for grief, bereavement support, mindfulness, emotional well-being, potentially outdoor activities aimed at restoring emotional health, maybe a structured walk or a hiking program, a youth adventure program, community and skill building, peer outreach programs, supportive exercise programs, among others. And this is the really fun part when we're reviewing the applications, to see all the creativity that's out there and to really review the great ideas. So the funding was allocated to support those directly or indirectly affected by the mass casualty event of April 2020 or other events that have caused grief and loss. So back to the slide before, who could also benefit from this? It's all people as well. So it's first responders, parents and families, adults of all ages, children and youth, diverse community, cultural abilities, newcomers, any person. All right, so what expenses are eligible? So projects serving Nova Scotia communities will be funded in this phase of funding. So applicants should consider the total cost of implementing a new project and identify which expenses are eligible based on project material and supplies necessary for implementing the project. This could include construction materials, art supplies, technology tools, personnel costs associated with the project. So this could be salaries for project coordinators, consultants, or contractors directly involved in the project. Marketing and outreach to promote the project and to engage the community. This could include printing flyers, social media advertising, website development. Event expenses. If the project involves organizing events for the community, such as a venue rental, maybe catering or transportation or permits. Training and capacity building, such as training workshops, sessions, or capacity building activities aimed at enhancing the skills and knowledge of project staff and leadership. Travel and accommodation costs related to the project. If the project involves bringing in external speakers, maybe, or participants or organizers, general administrative and operating costs, so up to 10% of the project value may be allocated to administration and operating costs, maybe office supplies, telecommunications, for example. So what's ineligible? Partial project funding. Projects or initiatives that are already underway, budget deficits, capital loans, costs covered by other government funding, entertainment fees, including alcohol, sponsorship, contests, gifts, or souvenirs, interest expenses incurred on operating loans, legal challenges, costs and settlements, mortgaging or mortgage financing unless specifically related to the project, loans, financing, administrative funding, professional organization fees paid on behalf of staff for membership or professional organizations.
Just while we're on eligibility here, I do have a couple of really good questions here that I do want to put forward to the floor. First question is, would a community-based research component be considered as an eligible activity?
I would think so. If it's new, if it's a new thought and a new research, I would think to put it forward. Yeah.
Okay, and Stacy, I know you asked that question. If you want more follow-up, and this is for everybody as well, if you do have more follow-ups and we can't answer your question directly right now, please send us an email. You can either email me or funding@nshpca.ca, and we will follow up with you within 24 hours with the correct answer. Next question I have here, can not-for-profit organizations support multiple grant applications from different partners? So for example, one foundation might have a number of different persons interested in creating proposals to be considered.
Say the first part of the question again, Meg.
Can not-for-profit organizations support multiple grant applications from different partners?
That's a really good question. So can one application from multiple partners? I think we might have to get back to you on that one. I have to think about that. That's a really interesting question.
So, Sarah, if you want to follow up or have, provide some more information on your specific question, send it to us and we'll get right back to you on that. These are all great questions. And just so everybody knows, this is phase 2 for us. And, we've learned a lot from the first phase and probably might be some questions that we're still navigating as well. But Tim, if you feel like chiming in, if you have direct answers to any of these, please do as well. Tim's our executive director at NSHPCA. One more question and then you can continue, Beth. Could the nonprofit organization be a national organization if it has an on-the-ground presence in Nova Scotia?
Yeah. Yes. I believe that would be fine as long as the project is happening in Nova Scotia.
Okay. We'll let Beth continue. And Leslie, I see, and Sarah, you have questions. Jennifer's a bunch of good questions here. We'll get back to those. We'll just let Beth continuing now. Thanks.
Great. All right, thank you. Okay, so funding and project length. So the level of funding will vary. As we said at the beginning, we have $500,000, which we're able to give out to the province. And the level of funding will vary from project to project and will be based on the nature of the proposed activities. The applicant can request up to $50,000. There's no minimum as well that someone could apply for. And project expenses must be used before March 31st, 2026. Okay, this is just a bit of an overview of the application process and what's included in the application. So applicants must submit a formal application to be considered for community funding. And this would include a completed and signed application form. Within this, a completed budget template, which details the project budget, outlining how the requested funds will be used. And project overview. This is where the concept can be expanded upon. It can list objectives as well as key activities that will be completed. Expected outcomes. Applicants will be required to state the expected short, medium, and long-term outcomes for their project or initiative. And timeline, a proposed timeline for project implementation, including key milestones and deadlines. And an impact assessment, an explanation of how the project will benefit the community and contribute to the organization's mission and values. And applications can be submitted through the online form, or fillable PDF can be accessed through our website as well. The application schedule reviews the timeline for the Healing Pathways Community Funding Phase 2. So the applications will close on February 14th, and the review period for the Community Funding Subcommittee will be 6 weeks. Applicants would then be notified whether they have been a successful applicant or not via email the week of March 31st. That's important. You will be notified either way. If you weren't successful, we will let you know. And letters of agreement will be sent to successful applicants in which they must sign and return by April 14th. And then funds will be distributed by the end of April. And as I said earlier, final reports would be due March 31st, 2026. The Nova Scotia Hospice Palliative Care Association will review all submitted applications, and staff, we will support the collection of the application and prepare the information for the Community Funding Subcommittee. So this committee is made up of community members, and it's led by Committee Chair Diana Whalen. And this committee reviews the applications, the eligibility criteria, and makes the final decision on which applications will move forward. The evaluation criteria includes response to identified community need. So this includes projects that will be prioritized, projects will be prioritized that propose community level support and services that are related to grief, loss, and emotional wellness. And then enduring impact, projects that expect to have a long-lasting impact will be prioritized. Public benefit, accessible, affordable, and inclusive to the general public. And then uniqueness and innovative. So projects that demonstrate creativity and uniqueness in addressing community need. Post-grant reporting and evaluation. So upon completion of the project, successful recipients will be required to submit a final report by March 31st, 2026, detailing any unspent funds along with the measured outcomes achieved from the project. Unspent funds that are over $50 must be returned to Nova Scotia Hospice Palliative Care Association at the time of the final report. Funding recipients that do not complete the post-grant outcomes reporting form will not be considered for future funding. Okay, and here's a few frequently asked questions, and I know we have a lot more. So I'll just address these ones quickly, and then we'll open the floor to your questions. So one may be, my project has already been started. We would like to request funding to continue the program for another year. Is my project eligible? The answer to that is no. The Healing Pathways Community Funding Grant is intended to support new community initiatives that begin in 2025. However, if there is an existing program that is having an additional offering, that could qualify. So we encourage you to be creative and think in that way. And if you're ever in doubt, we do encourage you to apply. We would love to, want to, of course, make sure it's eligible, but or reach out to us, maybe is a better way to say it. And that's why we're doing this webinar, to address some of those questions tonight. So the second one, my project has already received partial funding from a municipal grant or other source. Can we apply for the balance of our total project costs? Again, the answer is no. The funding grant is intended to support community-based initiatives that are standalone new projects. And then our organization received funding from Healing Pathways Round 1. Can we apply again? The answer is not for the same project. This funding is, as I've been saying, for new projects that have not already received funding support from Healing Pathways. However, if the organization has a new idea or a different initiative, they're welcome to apply. All right, so we're going to open the floor for more questions. Here is the contact information. This is our website with the Apply Now that you can access our application form. And here's our funding email as well as my phone number. So you're welcome to reach out directly after tonight if you think of more questions. All right.
Thank you for that, Beth. And Leslie, I did realize that halfway through that Beth may end up answering some of the questions that you've already asked. We're going to open the floor now to anybody who wishes to ask a question. Just you can unmute unmute yourself and ask the question by any way you want. So please go ahead. If not, I'll just continue to read some of the questions that we have here. So, okay, as we're waiting for a question, here's another one here, Beth. If I have an idea and have partnered with a nonprofit, do I write the grant as if from the perspective of the nonprofit, or simply show proof that I have partnered with them?
I think it's whatever makes the most sense. I think as long as there's proof that you've partnered, it could come from the perspective of the community group.
So, okay, so if somebody's working with a national organization and they have a footprint in a specific community in a project that they've been working on, they're seeking funding for it, they can apply on behalf of the community group, but in partnership with the national organization. Is that correct?
Yes.
The nonprofit organization has to be the applicant.
Okay.
Right.
Yeah.
Beth, can I ask a question, please? It's Catherine Murphy. So I have two separate ideas for funding requests, but the one that I'm questioning is can we apply for startup funds for the Hospice Society of West Hants, or do we need to have a project specific for grief in order to be eligible?
It's best if there's a direct goal with the funding. So if it's to do a certain part of the implementation that can be measured, that would probably be the best way to handle that. Tim, would you agree with that?
Sorry, it took me a minute to get myself unmuted. Or you could put in a proposal for a phase of it, would be another way to do it. We did see some examples of that in the first phase of funding, where organizations had ideas for a significant initiative, and so they created a proposal to do an initial piece of it that could stand kind of on its own.
Okay, thank you.
I think I see a hand up from Bereaved Families of Nova Scotia.
Yeah, hi Beth. Nice to meet everybody here. My name's Koli Malhotra. I'm with Bereaved Families in Nova Scotia. Our question is, we just recently became a service provider to the province to deliver programming on the ground in communities, but we're in an expansionary stage to put support programs and kind of one-on-one support as well. So there are different elements to it. And so with regards to the DEI, diversity, equity, and inclusion, we're trying to get to work with First Nations communities and French language communities and migrant groups as well. So there's a lot of work. So while I think I saw there that you won't support programs if there's a general mandate to support something already or that's being developed, I guess in our expansion, our dollars are very limited. And so, for example, we're just starting a pilot project in the whole Eastern Zone with all 6 First Nations communities. I have no dollars attached to it, and I don't even know where to go to begin that work, like in terms of numbers, in terms of getting support. So would specific projects tying specific areas of or types of communities, LGBTQ plus, for example, or First Nations, do they qualify as different projects, or are you looking at only one application for one organization?
Those are really great questions. I think there's only, I don't want to say only, because $500,000 is a lot of money. But knowing that organizations can apply up to 50,000, there's only so much that's going to go around. But that's not my decision. That's the subcommittee, the funding subcommittee's decision in the end. But I wonder if you applied for a few, I won't be, I don't know if they would be able to fund all of them, but it just depends on all the other applications, I guess. But definitely, if there's a focus or a way you can encompass, if it's new, all of it into one, that you can do that. Did that answer your question?
It kind of does, because the 50,000 limit kind of curtails that, so that's why I was thinking if you have 2 projects, for example, First Nations or French language communities, would they be separate, or do I have to try to pull it together somehow creatively in one? But 50,000 won't go far enough to support those communities. That was where I'm struggling with. But thank you.
And yeah. I mean, you could always apply. If anyone's ever not sure, apply and see, because it really depends. There's a lot of factors, how many other applications we have, how much the other applications ask for, because we're going to utilize the full amount and we want to make it stretch as best we can, but it's important that the projects are, which I'm sure they will be, are impactful and reach different areas and populations in the province.
Thank you very much.
You're welcome. Thank you. And see Natalie's hand up.
Sorry, I was having problems unmuting there for a moment. Thank you. Yeah, really grateful that this pool of funding has come out, and I see that it names that it's for grief, bereavement, and emotional wellness, which is a pretty wide spectrum. But I guess I just want to clarify, given that it's coming out of the Palliative Care Association, is there any kind of expectation that the projects be tied particularly to bereavement or loss or any aspect that's connected to palliative care or hospice contexts? Or is it really spread open to like the widest understanding of grief and the different types and forms of grief that many folks might be experiencing for various reasons at this time, as a species and everything that we're facing? So environmental grief, grief around social justice, grief around different various equity issues, things like that, and just perhaps even unnameable grief.
Yeah, great question. Thanks, Natalie. Yeah, we are Nova Scotia Hospice Palliative Care Association. However, this project is specifically grief, bereavement, and emotional wellness. So it could be tied, to palliative care or hospice care, but it doesn't have to. It's grief in general, or bereavement or emotional wellness broadly.
Wonderful. And I guess my other understanding is that like even if we're applying with an organization that might be a bit more located in a particular region, as long as the work is taking place within Nova Scotia, it falls within parameters. Like it could be anywhere across the province.
Yeah.
Okay. Thank you.
Folks, we do have only just over 3 minutes left in the meeting. We had some issues and technical issues with Zoom today, which is limiting us to that. So let's continue for now. And if for whatever reason we do have to end abruptly, we will follow up with answers to your questions as well, and potentially host another meeting probably in a month's time or so after we get some of the applications done.
Is there any more questions in the chat that?
Yeah, there's one here. If we're not successful this phase, is there a planned phase 3?
Tim, do you want to take that one?
Sure. We certainly hope so.
You said it better, Tim.
The one thing I was going to say, Michael, is maybe we'll because of the meeting ending soon, why don't we take the rest of the questions that haven't had a chance to be answered? We'll answer them and email them to everyone that's here.
Yeah, I've already started to record all of these, so no problem. Any other questions? Just feel free to unmute yourself and ask.
I'll ask one more. One of your stated outcomes earlier on was to look at projects that have a meaningful impact longer term in the communities. I mean, with regards to where the mass casualty came, we're near one with Colchester and the rest of it for the following years. So I guess the question got asked, what happens to funding down the road? And Tim, you mentioned, I guess that's dependent on what the province does. Is that what that means in terms of the $1.1 million that was originally funded? Is that? So in other words, we do a 1-year project and you implement something. There may not necessarily be sustainability. It's not guaranteed in terms of sustained funding. Is that what I'm hearing?
Yeah, so the initiative was created to help organizations create innovative approaches to support their communities. But one of the criteria is that you can't put forward a proposal that is that has to have ongoing funding to be initiated. Yeah.
Thank you.
Like it can't be dependent on multi-year funding in order to be able to do it. Yeah.
Thank you.